I just got home from the Colorado State Capitol where I spoke in support of the Diabetes Prevention and Obesity Treatment Act, which is a bill that will require most private insurances and Medicaid and Medicare to cover obesity treatment, including our... And it went well. The committee passed it 9-4, and we are on to a full House vote later this week. I think it's really important what this bill is doing, and I wanted to share a little bit of my speech and my testimony today. Native Americans suffer from some of the highest rates of obesity and diabetes out of any racial or ethnic group. Nearly 50% of Native Americans have obesity compared to 31% of non-Hispanic whites. Right here in Colorado, we reflect these national trends with over 25% of adults having obesity and over 35% being overweight. And Native Americans have the highest obesity rates out of any racial or ethnic group in Colorado at over 37%. With almost any other disease, healthcare and insurance professionals will treat them with medication covered by insurance. But when it comes to the disease of obesity, and to some extent diabetes, this is rarely the case. The root of the problems we see in accessing obesity care is weight bias. It's time to make policy decisions based on science, not stigma. Luck should not be a factor in a person's treatment plan. We must treat obesity the same as we treat other diseases and provide patients and their healthcare providers the tools they need to succeed in their lifelong struggles to improve their health. Many natives and other underserved communities are reliant on Medicaid and federal programs for their healthcare and insurance services. This bill would be life-changing and life-saving for many Native people, as well as underserved and underinsured communities in our state. And it passed. We've got a couple more steps and on to the governor's office, and a life-saving and life-changing bill could become law in the state of Colorado and serve as an example for other states. But sometimes you need to take that first step, advocate for what you know is right, and do what you can to help our community.